Thank you, sir. I'd like to welcome everyone this evening to our public forum regarding our task force update for our addiction, homelessness, and mental health task force that we run here in the city of Elkins. We are pushing 3 years of having this task force up and running, and we like to do a public forum and kind of test the waters, I guess, every now and then so people know what we're doing. We have some amazing partners behind the scenes that have come together and meet with us once a month and report on some services that they're providing to our citizens that are suffering or struggling right now. We have some churches that are involved. We have a lot of entities within the city that are involved. We have a core task force that meets every Tuesday at 9:30 to kind of figure out what the plan's going to be for our monthly meeting and figure out where our deficiencies are. We're actually very fortunate to have the services that we do in a city this size. What we're focusing on right now are saying, okay, what are the deficiencies and how can we fill those voids? And we've been doing that, like I said, for about 3 years now. We've made some great progress. You're going to hear some numbers and some stats tonight that I think will shock some people from behind the scenes, the people that are working with our officers, our peer recovery support specialists. I mean, they're doing an amazing job right now of getting people the help they need and getting their lives back. So welcome everyone. Like I said, we like to test the water every now and then and say tell people where we are, but we also are encouraging other people to get involved. I had a council member approach me about a month ago and say somebody came up to him and said, we need to fix a drug problem in Elkins. And his response was, if we could do that, we could rule the world, because it's not just in Elkins. But that's the area that we're focused on right now. And sadly enough, that's true. I mean, we do have a drug problem here, we have a homeless problem here, and we have some folks that are suffering from mental health, and we're aware of that. We're not ignoring it. So for the folks that don't think we're doing anything, there's a lot going on behind the scenes. So I commend our partners and the people that actually provide these services. I mean, we have some wonderful people that are helping these victims become survivors. So from my heart, thank you for that. And with that, I'm going to turn it over to our chair, Dave Parker.
Thank you, sir. I'd like to start by asking the members of the core task force, the small group, up here to introduce themselves. I'm Dave Parker. I'm on city council, but I also chair the task force. And the task force was convened initially by the mayor, and it was the right thing at the right time in the right place. And with that said, I'll let the other task force members introduce themselves.
Travis Bennett, Chief of Police for the City of Elkins.
Marky Jeffries, Peer Recovery Support Specialist for the task force.
Liz isn't here. Oh, there she is. Liz is our indispensable scribe for the group. She records every one of the things that we say, no matter how foolish it may be. And she just keeps us all humming along. Thank you, Liz. And I want to note, we also have some members from the large task force, the group that meets last Thursday of every month. And at that group, with all of our community and regional partners, we have consistently between 22 and 25 people. And I think that speaks volumes for an area that has a smaller population as we have. And we have the chief of police here from Parsons, great partner with our folks. And Margot Evick is here from the Children's Advocacy Center, and they do really special, critical work, and they do it very well. Glad to have you here with us tonight. Am I missing anybody from the big group? Okay. I'm going to move on to progress reports. There are a couple of things. The first item is going to be sober living homes, and I'm going to pass that on to Rob Williamson, one of our partners, a little later here as we go through the agenda. I've had some questions from the community about the opioid settlement fund, and I think there were very good questions. We have been actively engaged in that whole process as that fund was established, and then the state said they want to create a foundation, which I personally think is a great idea. And that foundation is going to operate separately. It is its own legal entity. And we were able to help support the election to the foundation board of a fellow named Jonathan Board from up at Morgantown, with whom we had been working for a couple of years, sorting out how we can make progress on the issues that we have faced as a community in dealing most specifically with the substance use disorder issues. Well, it turns out that Jonathan was chosen to be on the board of that group, and then he was selected to be the president of the foundation itself. He will be the director of the foundation itself. We believe we're going to be in a pretty good position. We're hoping so. With his replacement to the board, who is another very, very capable and experienced person who has worked extensively with sober living homes and facilities, and very successfully at that. And we're hoping that we can encourage his selection as the replacement for Mr. Board for this region on the foundation. So we're moving on that. Yes, and this is a 13-county region. It's crazy huge. I don't know what they were thinking when they made it up, but anyway, it's crazy huge. And I just think it's by the grace of God that we have been able to get terrific representation in the first place in position on the foundation. One of the questions that we've been asked about, that I have been asked about, was again this last week. And that is this money just going to be a giant political slush fund? Because you know, when all the settlements are paid into that fund to provide the corpus of the trust for this foundation, it's going to be the better part of $1 billion with a B when you add up all the settlements. It's a great deal of money. What Mr. Board understands, and what we deeply believe, is that to successfully address the issues that have been, put before us by the opioid epidemic, it's going to be generational work. It will not happen in 5 years. And that trust fund has to be extremely well managed. That foundation has to be extremely well managed and very focused for that money to last and for the work that's done with that funding to be effective. To that point, we have had more than a couple of conversations about how that money really ought to be used. And we firmly believe that it should be used on the ground at the grassroots level to provide direct care to those who are seeking recovery and their support, and for the children who have been so deeply impacted by this, and for their immediate caregivers. They need clinical supports. And right now, there's a real scarcity. And so we're very focused on that part of things. And we will continue to work as closely as we can with the foundation on it. But I want to assure you that I think there will be a brush fire if anyone tries to use that fund for political purposes. I think it's not going to go well for them. We'll try to hold them to that now. Anything else we need to say on that? Mr. Mayor?
No, sir, I think you covered it well. Like I said, our task force, the entire task force, we talk about this monthly, and we agree that we need to focus on our citizens that are currently suffering from addiction, but also a prevention standpoint. We need to stop the cycle somewhere. Like I said, and Dave mentioned or touched on it, we didn't get here overnight. We're not going to be able to fix it overnight. But you know what? You have to keep moving forward. If we can save one person or get one person, that's not one individual. That's one family that's getting healthy. It impacts so many people. The drug epidemic does not discriminate. It doesn't care what your socioeconomic class is. Everyone in this room probably knows somebody or is related to somebody or has a friend that's been impacted. So as typical West Virginians, we come together whenever someone's in need, and that's what we're doing right now in this community, is coming together and trying to come up with some solutions. Now, it's not going to be a quick, easy fix. I'm not going to make any promises, and I'm not saying that we can save everyone. But if we save one life, it's worth it. I think where we absolutely fail is when you have somebody who wants to get help and we have nothing to offer them. That's where we as a community and as a city fail. So that's why we're looking at the deficiencies that we currently have and trying to make sure that there's something available to these individuals to get them back and get their lives back. And hopefully get some healing going on with the families as a whole.
Thank you, sir. Okay. I would like to ask Margie Jeffries if she would give us an update and share with you all, just give you a little bit of insight as to what a peer recovery support specialist does. Margie is an exceptionally skillful and accomplished peer, and she is instrumental to the work that we do. We could not make the progress that we've made without her presence. And so, Margie, would you give us an update on your activity and maybe share with folks just a little bit of what you do?
I'm a peer recovery support specialist, but my main job is for Jobs in Hope, West Virginia. I cover 6 counties. Also, I'm the peer for the task force. I work closely with deputies in the county and especially EPD. As of last year, our numbers, I got called out 25 times. Out of those 25 individuals, only 3 did not stay in treatment. All the other ones are still in treatment. They're doing good. They're either in sober livings or back home with their families and productive members of society. And they keep in contact with me once a week, sometimes every day. From January 1st until as of today, we have had 14 calls. I had 3 in one day the other day, actually, and out of those 14, only 1 left treatment. So the other ones are still in treatment. They're still doing good. I keep in contact with them. And it's different from case to case. There's sometimes that I go to the scene, it's easy, find treatment, boom, it's done. There's other nights that I'm out for 8, 9, 10 hours. Sometimes I've worked 24 hours before to make sure that this person gets treatment and gets to where they need to go, because I will not leave that person until I know that they are safely where they need to go. And transportation has been an issue, but I have maneuvered around that as well. So that's our numbers, and that is what goes on behind the scenes with us.
Thank you. Margie, or maybe Travis, you want to say a little bit of something about how our officers are working with Margie and the peer program?
Sure. For this to work, it takes buy-in by law enforcement, and that's something that might not come really fast initially. Sometimes it starts with one officer who sees the benefit of how this works, that this isn't a problem that we can simply arrest our way out of and just lock everybody up and be done with it. That doesn't fix anything. Fixes it for a minute, doesn't fix it forever. So once the other officers see one person doing it and start seeing that it's a beneficial thing that helps them out as well, it starts to steamroll, and then you have an entire department doing it. You have an entire department that when they get on scene to something, they think, do I have some kind of other option to help this person other than simply arresting them and taking them to jail? And once we start looking at things that way, we start really making waves. That's why I think when she gave her numbers, we're close to 40 people altogether now that we've been able to do something, an alternative means than what the police normally do. And as the mayor said, that's 40 individuals, but if they know somebody, that's 120 people you might have affected just by that if they know only 3 people or have a couple family members around. So it's exponential what we're doing, and we're glad to be doing it, and we hope that we can influence others to do the exact same.
Thank you, sir. Rob Williamson, would you share with folks the news about the sober living homes and just generally the work the Recovery Resource Group is doing here in town?
Yeah, absolutely. So I'm Rob Williamson. I'm the founder of and director of A&T Recovery and one of the founders of RRG Behavioral Health. We came to Elkins, it's probably been 2.5, 3 years ago, with RRG Behavioral Health. It's an outpatient clinic. And we always had the hopes of being able to bring sober living homes to Elkins. And the reason for that is because what we have found, and in my own experience, that it's hard for someone to stay sober without the support of a community. And, they can have their family, they can have, their old friends, but without the community support of like-minded people, there's not much of a bridge there to keep that person pointed in the right direction. And that's the beauty of sober living, is that you're surrounded by your peers. So we've opened a men's and a women's home here in Elkins. You've got 12 beds for men, and you have 12 beds for women. And the posture that A&T Recovery takes is not only do we require them to participate in day-to-day life, like our residents are required to work and be a productive member of society. So you are going to see our residents working jobs. They're usually typically entry-level jobs, but they're there, they're participating in the community, they're paying taxes, they're bringing something to the overall economy. But we also take a posture to where we include clinical behavioral health services. So these residents have everything from therapy, primary care, medically assisted treatment. They've got peer support available to them in the home, and it's all in a loving, structured, healthy environment for that person to walk out what they have gained in a detox and a 28-day program. They can walk it out with us for a period of 9 months, even upwards of 2 years. Because over time we found that a person just doesn't graduate from a recovery program. You can't put a destination on someone's recovery. They grow out of these programs. So if a person's with us 18 months and it takes them that long to where they're able to be independent and financially support themselves in their own housing, well, they're welcome to stay with us until they have grown out of that level of care in that housing and they're able to be independent. We've had great success. We've been helping people with a sober living home since 2018, and we've probably helped a measurable portion of the state at this point. So we're grateful to be here. The town has been extremely open to not only the recovery program, but the residents. When we opened our first men's home here February 1st, we quickly had 12 residents living in the home, and it wasn't a matter of a couple weeks, and they were all fully employed. And then we opened our women's home April 1st, and we've seen that experience carry on. So we're entirely grateful that the local employers are receptive at hiring our residents, and just the overwhelming support that we have encountered since we've been here in Elkins.
Rob, if I could, first off, thank you for what you guys have done for us. I mean, you're one of our great partners as well. And we've had many conversations about the stigma associated with someone who's been through addiction. How are you finding the community now embracing that? I mean, are we doing better because we've had a few trainings on trying to change that stigma or remove that stigma from the individual? Everyone makes a mistake, but it shouldn't define your entire life, obviously.
Yeah, so I've not personally experienced that. I'm a person in long-term recovery as well, but it's been a few years. So I typically don't experience that stigma myself, but I do work hand in hand with these men and women on a daily basis. And I've not had any of them give me a report to where someone has looked down on them or judged them because of where they came from. And in fact, it's been quite the opposite. I think we've had 2 residents that got a job here at a local employer, and the guy didn't know anything about recovery, but he was like, I'm gonna give him a chance. And then a couple of days go by, and he was like, I would like to have a few more like him. Because what you find is you've got people who are now removed from drugs and alcohol. These are people that typically want to change their life, and given the opportunity, they'll outwork anybody in the room. And that's been the experience that we've seen for years. So yeah, no, the town support's been great.
Thank you, sir.
And one thing I'd like to add, one of the items that was high on our agenda, high priority for action, was to develop a sober living home for women here. What we learned fairly early on through Marky's legwork was that there's one sober living bed for women for every 3 for men in this state. And that imbalance was really a problem. I'm sure it continues to be a problem. And that Rob and his organization have been able to come in and just make this happen. We had spent, I don't know how long, trying to find a suitable house, looking at the cost to bring that up to proper standards for certification so that it wasn't just a roach motel. It really could feel like home to the residents there. We had reached a point where we'd worked out a collaboration with the Woodlands Development Group to build a new house on a piece of ground that Woodlands was willing to donate for that purpose. Bless them. They're tremendous community partners. Anyway, we're right at that point. We're in a conference call, video, doodah Zoom meeting with Rob, and Rob said, oh, I think I have a place for that. And so consequently, we did not have to finance and build and then deal with all the pieces of getting that house going. And we were talking with Rob about it because he said his group was willing to operate the house for us. But anyway, long story short, tremendous asset, and thank you.
You're very welcome. We appreciate the support.
I also feel like I need to give a shout out to the mayor of Huntington, Steve Williams. When we first started down this journey, I contacted Steve and said, hey, we're looking to put a task force together. Can you help us? We know you've been through the battle already. And he was so gracious. He invited us down. He pulled all of his resources together into one room. We toured the city for more than half of a day and learned a lot and made some connections there that were just invaluable to this community. And fast forward, they decided to move some of the services up here as well and expand. So, you know, like I said, it's not just Elkins, it's across the state, it's across the nation, it's across the world. But like I said, we're focused on trying to at least stop the bleeding a little bit here within our own community.
And now, Rob, would you like to introduce your partners? Rob has brought some partners into the mix here, and I had the wonderful opportunity to meet with them for the first time this morning, and I'll let you all take it from there.
Yeah. So who we've brought with us, so I'm one of the founders of RRG Behavioral Health. Ryan Fields is an additional founder of RRG Behavioral Health, and so is his wife, Heather Fields. She's one of our founders. We've been working together, you know, since 2018 to bring a lot of the things that we do to life. And then Terry joined our ranks here last summer, and he's the CEO now of RRG Behavioral Health, and he's pushing us into areas of healthcare that we really never dreamed we would be able to. But we're here today, and we're grateful for Terry, and Terry's going to share with you guys the next evolution or the next transition in care that we're working to bring here to Elkins. Oh yeah, and we've got Matt Wharton. He's there in the back here, and he is one of our peer support specialists that works here within the community and really does numbers for the betterment of our residents and our community clients. And then also you have Justice Brookover. He's the program coordinator here in Elkins for the sober living for A&T. And I'll go ahead and turn it over to Terry.
Thanks for having us. So we came up yesterday. We're staying down at the Tigard Hotel, and just watching what's happening here. So Mayor Steve Williams is a close friend. We started tackling the problems in Huntington 10 years ago, 12 years ago. So to hear that you've made that connection and that you're reaching out and what's coming to fruition, to have a police department that's willing to look at different avenues instead of trying to arrest your way out of a drug problem, fantastic. Marky got to meet her today as well. So when they brought me on to join the team, it was, here's where we're at, here's where we want to go, what do you think? And so before I joined RRG, I did consulting work and developed recovery centers, inpatient facilities, outpatient facilities across the nation. And if a behavioral health organization had problems and they were suffering as a business, they would call my boss would call me, and I would go in and try to address the issues. And typically had a lot of success with that. So one of the very first things that we discussed as a group was, based on where we're at, what's the information that we know and what's the needs look like per location. And we knew we needed to grow our services in Huntington, hire additional staff, raise the level of professionalism so that we had a core foundation of therapists that we could then take our business to another level. That led us to the discussion of what does the city of Elkins need. So growing our services, we started reaching out to local colleges. So Wesleyan College now offers a master's in counseling program. So we look to try to work with them as a community partner to hire some of their graduates of their programs within our facilities. Davis College with the medical track there. So Rob, he doesn't meet a stranger, and he had was connected to a lady who is going to be more than fair with us on a location here that we will develop into an inpatient facility. Ton of support today. Dave, fantastic. Fire Chief Himes was there today, had the fire marshal's office there. And the quick turnaround from one conversation last week to the following week, I'm not used to that. I'm used to people saying, sure, and then it takes me a month or two of continue to hassle and harass, not in a bad way, but to get people that are motivated to create change fast. And so today we get there, and email threads back and forth now with Woodland Development Group and all these different community partners. So we'll develop that piece of property into an inpatient facility. We're guessing it's going to house somewhere between probably around 40, 50 people maybe. It'll specialize in detox and stabilization. That's just a missing component locally in this region. I look for a community needs assessment, so I'm going to hassle Mon Health down the street to see what I can get, pull some more information for some more stats for us. 8 to 10 bed for detox stabilization, then we'll have probably around 30 beds, I think, for a residential stay. So that'll give somebody 28, 45 days to begin the recovery journey, and then we'll, refer out for outpatient services, whether that's internal, external, however we can do that. So grateful to be here. It is a warm reception, and I was telling Dave that this morning. So far, everyone that we've spoken with, there seems to be a sense of urgency, and that's where it starts. So out of my hands on how long that process will take, but it looks like with the interest that it's going to happen a lot faster than we originally anticipated. So I think the fire chief will help with the fire marshal's office. Come to find out that they're good buddies and have been for quite some time, and sometimes that's the the layover that you get in the response. So, but yeah, you can look for that too. That'll bring another whole level of resources. It'll create job opportunity, some of which are going to be entry-level positions for people in long-term recovery themselves. But then it's just part of the continuum that we need to further this along, and almost a safety net in a way too.
Jerry, thank you. In speaking with you and your team today, just in the whole group who were looking at the property, I was struck by how sharp your awareness is and your sense of preparation is to provide ongoing supports so that somebody doesn't just come out of treatment and be left in the wilderness. There will be ongoing supports available, as I understand it, at your facility. There will be the ongoing recovery work with RRG for the folks in the sober living homes. These are not just helter-skelter kinds of operations that we're talking about, they're very professional. They're very clear about what they expect. And I just think it's, this is the asset. And Mayor, you want to tell them a little bit about our history with the white paper and all that, and how this just sort of came to us?
Oh, absolutely. Like I said, well, first off, Terry, thank you for that announcement. That's tremendous news for the community to find this out today. I apologize I wasn't able to meet with you this morning. I was actually in Charleston and drove back a little bit ago. Yeah, we were going down a path where we were getting ready to do a white paper to get an assessment done to figure out how to spend our settlement money and to figure out where the needs were and where the best place to spend the money was. And we kind of figured it was going to be in this area, this arena of treatment, but we weren't sure how we were doing that with $21,000. So we reached out to some of our surrounding counties. I mean, Tucker County's already here, Upshur County's on board with it. Like I said, it's been a tremendous journey. But like I said, to say that you're surprised that it happened that quickly, I'm really not, because we like to execute. And we like to have a plan, but we also like to execute and get stuff done. I do think that we have some momentum right now that people are getting involved because they see progress. And I mean, maybe the general public doesn't see the numbers that we see, and maybe we don't toot our horns enough. I don't know, but that's not what you're in this for. I mean, you're in it to help people get healthy and get their lives back and help families heal. You're not in it for the self-glory. If you are, you're in it for the wrong reasons. So I don't think we announce what we do nearly enough. So every now and then we like to have a public forum so we can give you the numbers to say, yeah, we are still working behind the scenes. But yeah, you helped save us a lot of legwork by doing this because it filled the gap that we weren't able to overcome. So thank you and your team for that. I appreciate the announcement. I know Chief and I talked about it quite a bit whenever we first had the announcement that was possibly coming, and said, this is a game changer for our area. And not just the city of Elkins or Randolph County, this region, which is why we want to reach out to the chiefs, over in Tucker County and the mayor over in Upshur County, McCannon. That is our sister city. So when you say you're working with Wesleyan, we like that as well, because we're 22 miles apart. We both have large festivals. We have college towns. It makes sense for us to work together. So I love the fact that you're engaging them as well as Davis and Elkins College and getting them involved as well. It takes an entire village. So thank you for that. Like I said, you saved us a tremendous amount of work.
Thank you, sir. Just a couple points. Number one, I just want to be clear that you all have heard that there's going to be an inpatient treatment facility here. This is huge. This is really huge. It simply is. In the past, Markey or other folks have been having to drive their clients hours after they've called around the state to find a bed. This step forward is so significant, and thank you all for being willing to make that step. One thing
If I could, sir, please. When we first started this task force, and we got some feedback from the community, and a lot of folks came up to us and said, I don't want this in my backyard. And my response was always, it's already in your backyard. We're just trying to get these people help now. It's already there. We're just trying to get them healthy. So the people that are suffering, our citizens that are suffering, are already in your backyard. We're trying to get them healthy and get their life back to make them productive members of society, which makes your backyard even cleaner now. So it kind of frustrated me at times, but it seems like we're turning the corner now where people maybe aren't responding that way as much as they were, and they're embracing the fact that, yeah, people can get healthy. They're witnessing that. And I know that you guys work closely with Lydia, and she loves that. She brings that up all the time. She said, I love the fact you tell people that, and I'm so glad that we have them here. So, I mean, they love having you here, and so do we.
Thank you. And sort of the last, the last item on my agenda, and then we're going to open it up for questions from you all. And I want to thank you all for coming and being here tonight very much. It's great to see you. Last item on my agenda, we have hit the marks on our first action items, our goals that we had set for ourselves as a task force. And now, because this has all come together so amazingly, with the commitment and the investment of these partners, and I consider you partners in the community, Our next goal, our next big action item is the children. We have got to take care of the children. Right now, in Margot, did we lose Margot? Okay. Margot and I have talked about this, and I've talked with school counselors and different people. Right now, if a child is in distress, it can take as much as 30 days to get them in to receive some clinical help and some supports. It's 30 days. And every time one of our organizations, our good community organizations, thinks they've got the gaps filled for counselors, for clinical clinical therapists, they lose somebody. And that really has been a challenge. But we're going to go after that, and I think that we will partner with these folks in looking at how we want to address that, because I believe, Terry, you said you're going to have a clinical component for children. Is that correct?
That is correct. So my wife and I had moved to Florida for a couple years, and then I was telling Dave today, it's somebody I would consider a spiritual advisor, said, yeah, go to Florida for a couple years and you can come back. And I was like, I just don't know if we're going to come back. You know, my wife's really, wanting to go to the beach. So while we were there, she worked in adolescent treatment. And that is a component that we'll be bringing under our umbrella as well. So yeah, definitely. And you're right, and that helps with preventative measures. If we can start addressing trauma with kids, maybe they don't self-medicate as adults.
Well, and something we've discussed recently, the past few months, is the percentage of youth with suicidal tendencies has skyrocketed. And I wish Margot was still here because she could give you the number on that, because it's very unnerving and it would actually probably make you lose sleep tonight. COVID really highlighted that a lot, because some of the kids were stuck in a toxic environment 24/7 because they didn't have their outlets. They didn't have the school teachers or whoever that, that cared for them, and they got in these toxic environments, and it really weighed on them, and it's still weighing on them even after the fact. But yes, that percentage of the kids with suicidal tendencies has really went through the roof. So it's something we have to look at to get the children's minds healthy and to make sure that they don't turn down a dark path.
Margot Evick and I have already been in conversations about putting together some listening meetings with people who interact most closely and most frequently with the children. And that especially will include school counselors, therapists, and Margot and I are going to work out a list, but we're going to move on this for the care for children. We're absolutely committed to it, like we have been to getting the sober living houses open, like we have been to getting in a treatment facility, a real, honest-to-God treatment facility here that can support this region in our work toward recovery and greater health. So we will be coordinating with you all and any other partners who would like to be a part of that, and I'm hoping that we will be able to give you regular progress reports as we move on that. I expect it's going to require a lot of patience on our part. I don't think it's going to be low-hanging fruit. I don't think it's necessarily going to be easy, but we are fully committed to it. And so we will keep you posted, and you can hold us to that. And at this point, I'd like to open the floor to questions. Does anybody have questions or thoughts or? Yes, sir.
If you could please step up to the microphone. Sure. Thank you, sir.
I think I can speak loud enough.
Well, this is for the people that are watching online, though.
Okay. How do I get here?
Now, there's a little button right there to push, make a green light come on. It's on? Thank you.
You were mentioning Jonathan Board and the West Virginia First Foundation. When will the general public know the course of action and the first things that the foundation will be doing for the state?
Actually, we're kind of in a holding pattern for that right now. We received our first draw of money, which was $21,000, and I think the county received just short of $500,000. We're still waiting for some guidance on how the money can be spent exactly. With Jonathan, they actually had hired a director and then replaced that director with Jonathan Board. So we're still waiting for guidance. We have another meeting next month in Morgantown because the largest county hosts the meetings. So I'm hoping to have more guidance once we have that meeting to know how the money can be spent and how we can disseminate it.
Will support for a treatment facility be coming from the foundation? Will they be getting involved in direct initiatives like that? Or will they just be giving money to the local jurisdictions and it'll be up to local jurisdictions to decide how the money is used?
My understanding is that you have, if it's a treatment facility, they're going to have the ability, in the initial phases, the understanding, they have the ability to apply for some of this money, but they would have to apply, and then it goes before a board, and the board has to vote on it. But they're going to look towards the local region to try to say, okay, can you help us narrow the project, the list down a little bit, because you're going to have several people that are going to try to pop up silver living homes everywhere just to get a chunk of the money. And we want to make sure that it's done properly, that it's done,
And I would hope that they would serve in a leadership role in that regard. There would be a vetting process and meaningful use of the money happens, right?
Well, and that's what we're hoping as well, to be honest with you. Like I said, I wish we had better answers, but unfortunately, like I said, Jonathan's only been there about a month and a half now, and they're still getting everything lined up under him, trying to figure out how to have their meetings, how to be transparent in their meetings, how to broadcast that, get the information out. So, but as soon as we have that, we can push that information out as well.
Yeah.
We have our communication specialist back here who does an amazing job of sharing information. So once we get guidance on that, we can push that information out.
And I'm talking about systemic changes that foundation needs to lead.
I would agree with you.
And the other one has to do with the criminal justice system. I don't know what the statistics are, but I dare say at least half the people that are in recovery had a contact with the criminal justice system somewhere along the way. And somewhere along the way, the criminal justice system, that experience convinced them they needed treatment. And I deal with it all the time in the program that we're involved with. It's many situations, it's a revolving door. Unless you go to the state correctional facilities, there is no parole officer assigned. There's nobody that's putting the folks in a position where they should go to treatment or go back to jail, at least from my experience. And I hope that's another systemic change that'll happen.
Well, to be, I guess, sensitive to people's time, I'm not going to get on my soapbox or my diatribe about how broken our justice system is right now when it comes to handling some of these folks. So I won't go down that path, but we can have a side conversation if you like.
Well,
because
I appreciate that.
Because
but-
across the board, it is broken, and we've had those conversations. I mean, there's really not a lot of accountability right now, and I understand that there's shortages everywhere, but those need to be addressed as well. And to make sure that the people are doing their job properly and, trying to get help and not just kind of coming in, clocking in, and walking out the door, which you have occasionally.
And I'm not throwing stones at
No.
city or county police. I mean, it's a structural problem, and I'm glad we have peer review support specialists that are there when the opportunity is there. But anybody in jail because of drugs, there's an opportunity every time.
I will say this, I will go on record and say, I get frustrated when I hear my officers arresting the same individuals over and over and over, and I'm told it's because $47 a day or $57 a day, whatever it is now, to house an inmate is too much to keep them in jail, so they're turned back out. Well, it's costing us more than that from a municipality standpoint for that person to be back on the streets, because we're going to arrest them again. That's time for the officers. They're going to transport them back to the jail. I mean, and if they rob anybody or there's any property damage, that's more cost there. So the system's broken. And Chief, I don't know if you want to add to that or not, or if we want to go down that rabbit hole today.
So I will add to this. There is a peer recovery support specialist at Tigert Valley Regional Jail. She is actually my employee. I'm her supervisor, and she does a tremendous job. Right now, she has 131 clients on her client list. She gets 5 referrals every Tuesday. She is very, very good at pushing them out of the jail to get them treatment. depending on their case, depending on their charges, whether they're eligible or not. But she has moved so many inmates, and she has only been there since November. So that, the public does not know about that, but there's those statistics too.
But unfortunately, there's only one of her, and that's a challenge as well. And we're very shorthanded in our jails right now. Like I said, so I understand why people become frustrated and come in and go home. I mean, it's hard to buy in whenever you feel like you're fighting a broken system.
Yes, sir. Yes, ma'am. I'm sorry. Oh, that's Stuart. Hey, buddy.
Well, good evening. I know the purpose of this is for the purpose of awareness, so I just want to make some awareness, all right? One of the things that I think we have available to us is some other things that have already been established for a while. And talking about how the criminal justice system and the jails and the prisons and all that is broke. Personally, I am the substance abuse therapist for the Randolph County Drug Court. I'm a substance abuse therapist for the Randolph County Family Treatment Court, and I'm a substance abuse therapist for North Central Community Corrections. Travis, Captain, you would remember up at Huntsville when we did RSAT, and there was all of this information that's already built up there, and people are aware that if we can tap into, that wheel's already been built. Okay, RSAT exists in all of these different prisons, okay, and it's an amazing resource because it gives us something that we know what the inmates are participating in. And like you said, I mean, we started the Lighthouse Community Recovery Home, and then COVID came along, and COVID did its best to say, no volunteers, no groups, no people gathering. And our mentality was, from what I saw up at Community Corrections, I would go home to my wood shop and I would see people walking by my wood shop and they would stop and obviously be high on something. And I thought, I work with the judge, I work with the prosecutors, I've worked with the prison, I've worked with probation officers, if someone can do something about it, I can try to make an effort. So my wife and I started the Lighthouse Community Recovery Home, which is another recovery home, which is its own little entity. And I think it really, honestly, it probably works hand in hand with what these folks are doing. I don't think it's a competition. It's not a contest. There are more than enough addicts. I'm sure collectively we would be thrilled if there weren't any and we wouldn't need to exist. But unfortunately, there is a problem. And at that moment, doing something was better than doing nothing. We're not run by an agency. We're kind of an independent group of people who just know that there's a need. And one of the things that I think, and I've spoken with Marky about it, is there's an awful lot of services that are out there, and each service is kind of like a dot in a dot-to-dot book, but there doesn't seem to be a lot of things that connect those dots together. And I think as a task force, I'm sure you're all aware of what all those different dots are. And maybe the treatment facilities that you're talking about will take on that task of bringing some unity to individual do-good movements, okay? So I'm excited to hear that stuff is going on. If there's anything that we can do with our knowledge and our resources, we would be more than happy to help out in that regard, and maybe it'd be a win-win situation.
Thank you, Stuart. The one thing I'd recommend, and you may have already done this, is we've been utilizing 211 quite a bit. So if people want to know what services are available, you can actually download the 211 app, or you can call the number. If your service is not on there already, please do that so people are aware of what you have available for them. We're encouraging a lot of folks that are offering these services to do that. But I appreciate what you and your bride do for this community as well. I know you attended our meetings. Like I said, you were very valuable there. I appreciate your partnership as well. And I agree, it's not a competition. And I agree with your comment as well that I wish we could work you out of a job and work these guys out of a job. I think we're a long way from that, but it's good to have goals, I guess. So,
And when we started, we had the knowledge that there's this attitude that says, not in my backyard.
Right.
And we, as it happened to be the least expensive building in town, bought the old Nellis building. And when we toured the old Nellis building and someone was showing us that to buy it, we had a person from Huntington who was going to partner with us in our endeavor. And we left this one apartment. He said, "You smell that? That was crack." We went to another apartment to look at that apartment. "You smell that? That's weed. You smell that? That's meth," you know. And every apartment that we went into were people who were using drugs. And we found out after we acquired the property that it was like the biggest drug place in town, you know, and it had the reputation, and by working up at community corrections, you know, the people verified that. That's where I went. In fact, what's really crazy is we had a guy in the program who admitted to sleeping in the room that he used to buy heroin from. And he has since successfully completed the program, and his mom wrote my wife a wonderful text message that said, "If it weren't for y'all, my son would probably be dead." So we understand, we're with you. You know, you don't just affect one person, you affect the whole community. And I think it's great that there's other folks in town, that there's partners, you know, common enemy, common goal. You know, the goal is the common enemy is the addiction, and the goal is the healthier lifestyle. So when you say, "I'm not in my backyard," you know, that's why we've been kind of under the radar, because now we can sit. Actually, what happened was the Elkins Intermountain covered a story on the front page where a vehicle hit the front of our building. And we made the front page for like all the wrong reasons. And I thought, well, maybe now it's okay to let the secret out that we've been here, you know. So we are here. We think it's great that you guys are doing what you're doing. We welcome the RRG folks. That's a wonderful asset. I know there's a lot of folks at community corrections that participate in services, and it's just good. I mean, I don't know that we can have enough help. I think what we need is a better system of interaction, like you're saying, but I'll check into the 211 thing. Thanks a lot. That's all I have.
Thank you, sir. Any questions or thoughts out there? Anything more from the folks up here? Thank you for being here this evening. This meeting will stand adjourned if there is no further business. Take good care. We'll be in touch.
Thank you.